What tips can you offer patients to support them in advocating for themselves with medical professionals when they feel their needs are not being met due to providers' biases and cultural differences?
Yeah, that's a huge one, because like the medical field in and of itself looms large as like a powerful institution, and so even in that way folks may have like a double layer of feeling oppressed and not feeling like they have the language and the way to move through. So like I said, with when it, I specifically said this for mental health, but I think it also applies to all medical providers. If you have a question about how something you're impacting as it relates to your identity is showing up in your health, naming it and seeing what they say. Seeing how they respond, seeing what they're willing to provide you in the way of information and resources. And that's a huge one, because so often we don't think that when we're going into a doctor's office that it is a bi-directional relationship. And it is. There are a lot of doctors. There are a lot of therapists. And so being able to recognize that, yes, you're coming in because you need something, but also recognizing that that does not give them power over you. It should be a collaborative experience. And if they're not bringing what you need them to bring to the table, then it might be time to look for another provider. I also just want to note that even me saying that, I know speaks to some of my privilege when it comes to access to resources. I know that a lot of people don't have that level of access to be like, well, I'm just going to swap providers easily. So I would say in that situation, if you're saying, I'm experiencing X and I need this to be a part of my treatment plan, and they're continuing to blow you off, I would say using language like, okay, I would like it noted in my chart that I've asked for this and you are denying that to me. I want it noted, right? And I want it somewhere in black and white. And so then now we're not just talking about what's happening in the room between two people. Now we're talking about what's on your medical chart that you have the rights to ask for access to. So then that might change the tone of the conversation. Also being able to be aware of who governs certain providers. We're all governed by ethical boards. And so if something's happening that you really feel like is unethical, you have every right to file a complaint. And so really looking into ways that you can empower yourself with knowledge, and then making it clear that you're willing to use that. The last thing I would say is reaching out to your support systems and seeing who they're seeing who are affirming. So before I started to go see a dermatologist, I reached out to folks in my community because I wanted somebody who was not just going to treat my acne, but who was also going to recognize the complexity of how my identity impacts what I'm experiencing. So for example, I'd gone to dermatologists for years who wanted to give me bleaching creams for dark spots. I don't want to use a bleaching cream for a number of reasons, but also because of the effect that it'll have on my skin. And when I finally got connected with who I'm connected with now, she never mentioned a bleaching cream. She mentioned this like botanical cream that's really expensive but really effective. And we talked about, so it'll take longer, but it won't have these negative effects on your skin. It won't cause for the kind of ringing that can happen with bleaching. And more importantly, there's such a history of how bleaching has been used to whitewash communities. And we were able to have that conversation, and that was so restorative to have with a doctor. And so being able to reach out to people in your community to see who they're working with, who are affirming.
Okay, last question. Could you also speak to how this affects to biracial people?
Yeah. I think that, and I'm actually glad for that question because of the question, but also for something that I meant to say in the beginning that I neglected to say, so excuse me. But that we're talking about racial trauma, and there are all these other intersections of identity that we don't have the time to talk about. So gender, right? Somebody asked specifically about Black men, and you know, we're not talking about non-binary and trans and queer populations, right? The impact of those double identities. We're not talking explicitly about sexuality and religion and region and all these other identities. So all those things certainly are going to impact even how racial trauma is experienced. And specifically with multiracial or biracial folks, I'll oftentimes hear that they experience kind of a double burdening, right? Not enough for either community, right? Like those are the messages they receive. Or there can sometimes be, because of the history of how binary we talk about race, they can oftentimes feel like they exist somewhere in this spectrum that is not identified and given space to really breathe and have conversations. So I think one of the things that I would say is how you identify is how you identify. Some folks identify multiracially, and some folks will identify both as having multiracial culture and ethnicity, but also will say, and I identify as X, right? How you identify is going to shape the messages you receive and how people see you. And so really being able to do a ton of that work that I talked about challenging negative and distorted messages is a huge piece, but also being able to seek out support and seek out spaces that recognize, embrace, and empower your identity, I think is a huge one as well. I also think we think about being at the polls so often that there's a lot about this mosaic of identities that we aren't talking about, and there can be a lot of beauty and complexity in being able to embrace that and being able to have people in your life who embrace that. And that's where boundary setting might come into play. So recognizing who is relating to you in a way that does not meet with how you identify, even if it's complex, right? You have every right to have people show up for you in all of your identities and in all the ways that you identify. And so that's where boundary setting might come into play. But also I think a lot of the other things that I mentioned still do apply. It's just also thinking about the intersections of identity that feel really, really important. I met a trainee a while ago. I do some supervision at a different job. And she created this whole website specifically for multiracial trainees in mental health, because she identified that there was like a space that wasn't being filled. And so being able to find those spaces, being able to create those spaces too, if you have the bandwidth and the energy to do so, I think is huge. But also really, really being able to challenge any of the systemic messages that are received that don't align with how you identify, and being empowered in that. That was a long answer. I apologize. It's a very long one.
It's okay. So that is the last of our questions. I would like to make a little statement of, I would love for this thread underneath this video to become resources, pages that, can either relate to this or help more or whatever, book recommendations, people that you want to follow, anything related. I would love this thread. So everybody who's on, whoever watches later on, go ahead and make a comment at the bottom of your favorite book, your favorite TV personality, your favorite pages that you follow, and it'll just be a resource for everyone to go to.
No, I think that's a great idea. I certainly have some folks who I want to pin under there and would love to see that conversation happen. Yes. So that's awesome.
So do you have a closing?
I don't know. It was nice to be to have a closing. It was nice to be here with you all today. Again, I think that this is such a deep topic that pervades so many different systems. This couldn't be anything but an introduction. So please continue to do the work. Continue to seek out the knowledge. I'll certainly try and be as active as possible on the thread, because I would love to be able to engage with folks. I really love it, not just from a lived experience perspective, but I truly do think that this is a part of mental health that has gone untreated. Untreated for a while. So I'm really excited to see where it's headed, and thank you.